Hi friends, this is Parvati from Capstechy. Welcome to my channel. I need your support, so please subscribe, share and like my videos. Also, you can mention your valuable comments in the comment box. Also, you can share with your pharmacy friends. In any exam, you can use my materials for the preparation. Okay. Today we are discussing here the continuation of autonomic nervous system. Cholinergic agonist and cholinergic antagonist are the main topics we are discussing here today. Okay. So the first slide I mentioned here, the same repetition from the first video, the parasympathetic action and sympathetic action, because these are the basics of this chapter. If you understand the basics, actions, the parasympathetic and sympathetic, you can easily understand the remaining portions. So that's why I mentioned here again, because these things are the myth of this chapter. Okay. Then the next one we are discussing here, the cholinergic agonist. What is the cholinergic agonist? We know it's stimulation of the cholinergic receptors. That's the function of the cholinergic agonist. The medicines that mimic the action of acetylcholine, that means it's same as act like acetylcholine. So the drug that stimulate acetylcholine receptors and producing the parasympathetic type effect. Okay, that means parasympathomimetic. So that's why the cholinergic agonist drugs are called parasympathomimetic. It's same as act like the acetylcholine. Okay. Then we already studied the next point, cholinergic receptors. That means the cholinergic receptors are mainly two types, nicotinic and muscarinic. These are the main cholinergic receptors. In the next slide, I discussing this one also, the repetition from the first slide, the first video, because we want to know it how the acetylcholine, the neurotransmitters affect on the adrenal medulla and the effector cells, and what's happening in the sympathetic, parasympathetic, what are the receptors and what are the neurotransmitters. So that's why I mentioned again here. This also we want to know it and we want to remind it. So that's the purpose of this image again here. Okay. And the next slide we are discussing here, the first cholinergic receptors, muscarinic receptors. We know the receptors are different types are coming. So the muscarinic receptors is a type of G protein coupled receptor. It's also known as metabotropic receptor. So these point based questions also we can expect in the cap. So please note in your notebook. Okay. And binding to, what is the what are the main neurotransmitters binding on the muscarinic receptors, acetylcholine, muscarine and the nicotine. The affinity is coming, the muscarine in the highest affinity, then acetylcholine in the least affinity is coming for the nicotine. Okay, mainly the muscarinic receptors are again classified into three types of receptors, M1, M2 and M3. M1 is mainly present in the gastric parietal cells. That means the contraction of muscles is happening on there, so increase the digestion. We know what are the important actions of the parasympathomimetic action. In the parasympathetic action, we know the digestion is increasing, the gastrointestinal activity, the movement of the motility is increasing. So that's why the digestion is happening on there. So M1 is mainly present in the gastric parietal cells. In the M2 is the second type, where it's present in the cardiac cells and smooth muscles. In the cardiac cells, what's happening on there? It's decrease the heart rate, that is called the bradycardia. So that is the action of muscarine, in the action in the muscarinic receptors, M2 receptors in cardiac cells. And then the M3 receptors is mainly present in the bladder, endocrine glands and smooth muscles. We know in the bladder, in the parasympathetic action, mainly the contraction of muscles. That means the urination is happen on there. Okay. These are the main three types of muscarinic receptors. In the second slide, we are discussing the second type of receptors, nicotinic receptors in the cholinergic receptor. Okay, the nicotinic receptors also, it's a type of ligand-gated ion channels. So it's also known as ionotropic receptor. One of the important point whenever I discussing and whenever I'm display the slides, I highlighted some points. That means the points are very important, and some slides I mentioned the NB, that's also very important. NB important, like that I mentioned, that is also very important slide, so don't miss to check it, that one. These are the main important points we want to focus at the end of the revision. Okay. Then, we can continue from the nicotinic receptors. So nicotinic receptors also the ligand-gated ion channel, also known as ionotropic receptor. So it's binding to the acetylcholine, mescaline, and in the nicotinic receptors mainly binding acetylcholine, mescaline, and nicotine. The affinity is highest level in the nicotinic receptors is nicotine, then acetylcholine, least affinity for the mescaline. In the nicotinic receptors, nicotine at low concentration, it stimulates the receptors. So it's producing the agonist action. And nicotine at high concentration, it blocks the receptors and producing the antagonist action. So very basic point. We want to thorough with these things. Okay. So the antagonist action, two examples I mentioned here, very important. We can expect questions based on this one. Okay. The ganglionic receptors, and the ganglionic receptors are blocked by the mecamylamine, one of the example of antagonist action. The second example is in the neuromuscular junction receptors, and receptors are blocked by atracurium. Atracurium, what's the function of that one happen on there? Relaxation of the skeletal muscle. So the next one is discussing here, the point is what are the locations of the nicotinic receptors in CNS, adrenal medulla, autonomic ganglia, and neuromuscular junction in the skeletal muscles. Okay, mainly two types are coming for the nicotinic receptors, NM and NN. The NM is located in the neuromuscular junction. So what the function of that one means? Contraction of the skeletal muscles, means the skeletal muscle contraction is happening on there. Okay. Then NN, it causes the depolarization in autonomic ganglia, so it's resulting in the postganglionic impulse. These are the two types of nicotinic receptors. Okay. Then the cholinergic agonist drugs are discussing here. The cholinergic agonist drugs, mainly two types are coming: direct acting and indirect acting. In the direct acting, it's again classified into two types: endogenous choline esters and naturally occurring alkaloids. In the endogenous choline esters, the main drugs are coming: acetylcholine, carbachol, bethanechol. Naturally occurring alkaloids, mainly we know about the alkaloid form of pilocarpine. Okay. The next classification for the cholinergic agonist is indirect acting. Indirect acting again classified into two types: reversible and irreversible. Reversible, mainly the drugs are discussing here: edrophonium, physostigmine, neostigmine, pyridostigmine, amphenonium, tacarin, donepezil, rivastigmine, and galantamine. We know the tacarin, donepezil, these drugs we also studied in the other chapter also for the Parkinsonism. These things we are discussing on there also. Okay. And the irreversible, the organophosphorus, parathione, malathione, and ecothiophat are discussing. Okay. These are the main classification of this one. In the next slide, I mentioned here the mechanism of action of direct acting and indirect acting cholinergic agonist. Okay. From the picture, we can understand what's happening on there. So again, the next slide, just for understand for the mechanism of action, so that's why I mentioned the image. Just go through with this image only. Okay. The next slide, some of the important slide. So the first drug we are discussing here in the direct acting is acetylcholine. So acetylcholine, it's a quaternary ammonium compound. So mainly two activity actions are there: mescarinic and nicotinic activity actions. What are the main actions happening in the acetylcholine? We know the cholinergic agonist is parasympathomimetic. That means parasympathetic action is producing. What are the important parasympathetic actions? That means the cholinergic agonist action of acetylcholine is decrease in heart rate. Decrease in heart rate, that means the bradycardia. So the next action is decrease in blood pressure and increase salivary secretion. The secretions are increased in the parasympathomimetic. So the intestinal secretion also increase the intestinal motility, that means digestion is happening on there, and increase the tone of the detrusor muscle, that means urination, contraction of the muscles. Then increase the ciliary muscle contraction, so constriction of pupil. This action is called meiosis, one of the important point. Okay, the main use of the acetylcholine is it's used to produce the meiosis in ophthalmic surgery. So it's used in the ophthalmic surgery for producing the meiosis action. These are the main actions of the acetylcholine. So very important. We want to thorough with this one. Okay. Then the next one is botanical, and when this reference everything based on the Lippincott 6th edition. If you have the updated edition, you can check it on there. Very condensed form of the topics only I mentioned here. If you want the description about this one, you can check in the textbook, but these are the main important points we want to know about in any exam for the pharmacology, for the pharmacy. Okay. The next one, botanical. So botanical, the action is mainly the strong muscarinic activity for botanical. It's the nicotinic activity is not showing. That means the lack of nicotinic activity due to the addition of methyl group in the botanical. So that's why it's not showing the nicotinic activity. This is the main reason of that one. We can expect questions based on this point also. Then the next one is the therapeutic uses of the botanical. So what are the important uses? In the atonic bladder, the stimulate the atonic bladder ability to contract, that means increase the urination. We know the cholinergic agonist action is increase the urination, that means contraction of muscles is happening there. So that's why it's used in the postpartum or post-operative disease, post-operative purpose to increase the urination. Botanical is used. Okay. That means what's happening on the urinary retention. So that's why we want to use this one in the post-operative or postpartum condition. Okay. The next use is neurogenic atony and megacolon. That means what is the neurogenic atony and megacolon? I already mentioned here, abnormal dilation of the colon, dilation of the colon. This condition is called neurogenic atony, and megacolon is the condition of abnormal dilation of the colon. Okay. So it's using by stimulating the smooth muscle contraction. So that's why it's used on there. These are the main two uses of the botanical. Okay. Then carbachol. Carbachol, we know the cholinergic agonist, one of the important action is meiosis. So the carbachol is used in the condition of glaucoma. Glaucoma means we know the glaucoma, what's happening on there. Condition of the glaucoma means increase the intraocular pressure in the eye. So that's why we are using the carbachol in glaucoma. What the function of carbachol? Carbachol means it's decrease the intraocular pressure. That means the contraction of pupillary contraction is happening on there. So that's why it's using on that, decreases the intraocular pressure. This is the main use of the carbachol. The next drug is we are discussing here pilocarpine. Pilocarpine, very very important drug. We want to thorough with that one. Okay, the one of the important drug of choice in the emergency lowering of intraocular pressure in glaucoma. One of the important use of pilocarpine. We can expect the questions based on this one. So thorough with this one. Okay, main uses I already discussed. We already discussed glaucoma. That means the open angle and angle closure glaucoma. Both cases we can use it, the pilocarpine. And the next use is xerostomia. Xerostomia is the condition, that means the dry mouth resulting from reduced or absent of the salivation. Okay, that means the saliva flow is decreased. That condition is called xerostomia. So what is the pilocarpine action on there? Pilocarpine means it's a cholinergic agonist and it's producing the parasympathetic effect, parasympathomimetic action. So what's doing on there? It increase the secretion of salivary glands. So that's why the pilocarpine is used in the xerostomia condition. The same action is happening on the Sjogren's syndrome. Sjogren's syndrome also leads to the dry mouth and dry eyes. So we want to increase the secretion on there. So that's why the pilocarpine is used on there. Okay. The other action is the pilocarpine. In the pilocarpine overdose, the antidote is used for the pilocarpine is parenteral atropine. These are the main uses of pilocarpine. Then ADR, the adverse effect is discussing here. From the next slide, we are discussing here the common adverse effect of cholinergic agonists. These are very important. We want to thorough with this one, adverse effect of cholinergic agonists. Common adverse effects are the diaphoresis, that means sweating, we know it increases the secretion. So that's why the diaphoresis, urination, meiosis, blood vision, bradycardia, bronchospasm, bronchial secretion increase, emesis, vomiting, and lacrimation, loose stool. These are the main common adverse effect. Okay, the first letter of the each one we can make a short form and we can tarot it and we can remind it easily also. Okay, try to do it like that. Okay, the next slide we are discussing here, the indirect cholinergic. We know direct acting and indirect acting. Direct acting we already finished. So the next one is indirect acting. The indirect acting cholinergic or anticholinesterase mechanism of action is I mentioned in this image. Easily, we can easily identify from this one how it's happening on there, how the mechanism of action is happen on there. Okay, in the next slide I mentioned detailedly. So what's happening on there? The acetylcholinesterase is an enzyme that specifically cleaves the acetylcholine to acetate and choline, and this terminates its action. This is happening normally on there. So the inhibition of acetylcholinesterase, that means the anticholinesterase agents or cholinesterase inhibitors, these are indirectly provide a cholinergic action by preventing the degradation of the acetylcholine. That means it inhibits the degradation of acetylcholine to acetate and choline. This is the main mechanism of action of the indirect acting cholinergic agonist. So the next section, how the drugs are acting on there, that's I mentioned here. Both are the images basically same. One, the general action, and the next image I mentioned here, what is the drugs, how it's happen on there. Okay. In the next slide, we are discussing the drug of the indirect acting. The first drug is edrophonium. Edrophonium, it's a short-acting acetylcholine inhibitor. It's mainly used in the diagnosis of myasthenia gravis. Very, very important point. We can expect questions based on this one also, because the diagnosis of myasthenia gravis, edrophonium is used, and mainly the treatment of myasthenia gravis, neostigmine, pyridostigmine and ammononium is used for the treatment of myasthenia gravis. So don't confuse with this one. The options also same as like that. So what is the question? Based on that you want to choose it. If the diagnosis is of the myasthenia gravis, we want to choose it edrophonium, and the treatment of myasthenia gravis, we want to choose it neostigmine, pyridostigmine or the ammononium. Okay, one of the important slide we want to thorough with this one. So the next drug we are discussing here, physostigmine. This is also important. Okay, the action is intermediate action and uncharged tertiary amine that can penetrate. It can penetrate the CNS. So the other important point is the cholinergic agonist drug can penetrate the CNS is physostigmine. So the main uses of physostigmine is, we already mentioned it can penetrate the CNS. So what's happening on there? It can use in the reverse CNS and cardiac effect of tricyclic antidepressant. That means it can use for the reverse action of adverse effect of tricyclic antidepressants. We will discuss the adverse effects and the details about the chapter in tricyclic antidepressant. So we want to know the use of this one. So that's why I mentioned that one only here. Okay. So the next use of physostigmine also, it's also used for the overdose. That means the overdose of drug, physostigmine overdose, we can use the atropine. That means the atropine is the antidote for the physostigmine. Okay. The next action is action of the physostigmine. Mainly action we know, these are cholinergic agonists. That means decrease the heart rate. So cholinergic agonist action is same as like parasympathetic action. That means parasympathomimetic. So what are the actions on there? Bradycardia. Bradycardia means decrease the heart rate. Hypotension means decrease the BP. Meiosis means contract the pupils, and contraction of visceral smooth muscles. These are the main actions of physostigmine. So each and every drug actions, please thorough with it. It's very, very important. Okay. Don't confuse with the other drugs action also. So what is the simple definition is the parasympathomimetic, parasympatholytic. If you thorough with that one, you can identify easily. So again I'm stressing of that one. That is the important thing. Okay. And ADA, what are the adverse effect of the physostigmine? Convulsions in CNS. Convulsions means the simple definition of convulsion means the body muscles contract and relax rapidly. That is called the convulsion. So main ADR is convulsions in CNS at high dose, bradycardia and fall in cardiac output, then paralysis of skeletal muscles. Paralysis skeletal muscle, what is that? Accumulation of acetylcholine at NMJ, neuromuscular junction. It's rarely only happening. These are the main adverse effect of the physostigmine. What are the highlighted points? That is very important. Okay, we want to thorough with that one. Okay. The next drug is we are discussing here the neostigmine. Neostigmine has a quaternary nitrogen. So it is a more polar and antidote for competitive neuromuscular blockers also use neostigmine and poorly absorbed from the GI tract and does not enter the CNS. These are normal introduction points for the neostigmine. Uses means we already discussed edrophonium for the myasthenia gravis diagnosis. Neostigmine, pyridostigmine and ampannonium are mainly used for the treatment. So that's why the neostigmine uses myasthenia gravis. Okay, manage the symptoms of myasthenia gravis. That is the use of neostigmine, one of the important point. And ADR we know always the same. Almost the same as like everything. Okay, what is the parasympathomimetic actions? The same thing is the ADR is coming here also. Okay. And the next one we are discussing the drug is pyridostigmine and ampannonium. Pyridostigmine, ampannonium we already know. The use is important. It's used in the myasthenia gravis for the chronic management. Okay. And ADR of these agents is similar to neostigmine. Okay. The main important point is myasthenia gravis. So that's why I mentioned that one only. If you want detail about this one, you can check in the textbook. Okay. The next drugs we are discussing here, tacarin, danapsil, rivastigmine and galantamine. These are mainly used in the Alzheimer's disease. Okay. I think in the first slide I mentioned in the classification time, I mentioned like Parkinsonism by mistake. It's used in the Alzheimer's disease. Okay, so the deficiency of cholinergic neurons in the CNS, that is the Alzheimer's disease. That is the definition of Alzheimer's disease. Okay, the tacarin, danapsil, rivastigmine and galantamine are mainly used for the Alzheimer's disease treatment. Okay. And tacarin is replaced by other agents because of the tacarin have one of the important side effect is hepatotoxicity. Because of this one, it's replaced with the other agents. It's important. Okay, the point we can just remind it. Save in your mind. Okay, the other agents can delay the progression of Alzheimer's disease. None can stop its progression for the knowledge I just mentioned. Okay, and the main ADR of the these drugs is very important. Main ADR is GI distress. Okay, gastrointestinal distress. These are the two important points we want to thorough with this drugs. Okay, hepatotoxicity and the adverse effect of this one. Why that tacarin is replaced with other agents is the reason is hepatotoxicity, and important ADR is the GI distress. Okay, please thorough with these points. And then the next section we are discussing here. So the first one we discussed here, indirect acting reversible. So the next one, indirect acting irreversible. So the synthetic organophosphate compounds which binds covalently to acetylcholinesterase and leads to long-lasting increase in acetylcholine. This agent is called the irreversible. How the irreversibly it's acting. Okay, the examples are very important: parathione and malathione. So these are mainly used in the insecticides. Okay, one of the important point from this section. We can expect questions based on this one. Please thorough with this one. Okay. And the first drug we are discussing here, ecothiopate. Ecothiopate, the actions mainly, it's generalized cholinergic stimulation. We know we are discussing here the cholinergic agonist. So it's a cholinergic stimulation action it's producing. Okay. So that means the paralysis of motor function So it's causing the breathing difficulties and convulsions also. Okay. Then the uses is we are discussing here. The one of the important uses are it produce the intense meiosis. We know we are discussing here cholinergic agonists. So the meiosis action is there. So used in the treatment of open angle glaucoma. If meiosis action means we can use in the glaucoma condition. Okay. So the rarely used yearly use due to side effect profile, which includes risk causing cataracts. This has some side effects, so causing the cataracts, so that's why it's rarely used only. Okay, rarely used this one. Okay, and main antidote of this one, high dose of atropine. Ecothiophyte antidote is high dose of atropine. This is the one of the important point from this section. Please thorough with it and please note down. Okay, and the next drug we are discussing here, what are the important, this much only we want to know about the cholinergic agonists. This is the end of the cholinergic agonist portion. So what are the important antidotes for anticholinesterase agents? Pralidoxin can reactive inhibited by acetylcholine esterase. Okay, the atropine we can use prevent the muscarinic side effects, and diazepam we can use it to reduce the persistent convulsions. Okay, these are just for the antidotes and the anticholinesterase agents. Okay, some other notes I mentioned here, that means I whenever we are checking in the recalls and whenever discussing the question answers, if any point is missed in the backside questions in the Lipin court also, that time we are just note down in the note section. Okay, some of the points we are discussing here again. Botulinum toxin, it's a skeletal muscle paralysis. The action of this one is skeletal muscle paralysis relaxation. So the botulinum toxin causes flaccid paralysis of the skeletal muscles. Okay, and it's also have the heart rate decrease, and it decrease in the salivation also. In the salivary glands, the next point is salivary glands. Salivary glands, mainly the muscarinic receptors is there. So the acetylcholine receptor stimulating saliva production. We know the cholinergic agonist action is increase the salivation, increase the secretions in the parasympathetic action, parasympathomimetic actions. So the salivary glands, muscarinic receptors are presenting. Okay. And the next point is muscarinic receptor antagonists such as tropicamide and atropine are commonly used to dilate the pupil, mydriasis in ophthalmology. I just mentioned here, this is actually it's coming in the next section. By mistake I mentioned here, but just note down. Okay, this is I already mentioned there, muscarinic receptor antagonist. So it's coming under cholinergic antagonist. Okay, sorry for that, but just note down. Anyway, I mentioned here also. Okay, the next one we are discussing here, cholinergic antagonist. Cholinergic antagonist means the agents that bind to cholinereceptors. Cholinereceptors we know muscarinic and nicotinic, and it prevent the effect of acetylcholine and other cholinergic agonists. So it inhibit the action of acetylcholine. That is the cholinergic antagonist. Okay, the first one, the most clinically useful of these agents, mainly three types are coming. The first one is selective blockers of the muscarinic receptors. These are mainly also known as anticholinergic agents, antimuscarinic agents, and parasympatholytics. So don't confuse with that one. Cholinergic agonist is parasympathomimetic, cholinergic antagonist is parasympatholytic. Okay, we already discussed this one in the basics introduction portion also. Okay, and the next classification is ganglionic blockers. Ganglionic blockers means they shows a preference for the nicotinic receptors of the sympathetic and parasympathetic ganglia. These are called ganglionic blockers, mainly preference for that one, for the ganglia, sympathetic and parasympathetic. And the third one is neuromuscular blocking agents. It's mainly for the nicotinic antagonists. It interferes with the transmission of efferent impulse to skeletal muscles. These agents are used as skeletal muscle relaxant. One of the important point, neuromuscular blocking agents is used as the skeletal muscle relaxant. We are discussing here the drug of succinylcholine in the coming slides also. Okay, we can continue for this one. The main classifications are coming the drugs for this one. Antimuscarinic agents, mainly the drugs are coming atropine, benztropine, cyclopentolate, darifenacin, fesoterodine, ipratropium, oxybutynine, scopolamine, sulfonacin, tiotropium, tolterodine, trihexyphenidyl, tropicamide, and trospium chloride. Okay, these are the main drugs are discussing here. And the ganglionic blockers, we already discussed this one, nicotine. And neuromuscular blockers, mainly the cisatracurium, pancuronium, rocuronium, succinylcholine, and vecuronium. Okay, vecuronium, sorry. And the next one I mentioned here, the antimuscarinic agent. We are discussing that one. So the mechanism of action for the competition of atropine, and this one for the muscarinic receptor I mentioned here, just for understand only. Just check the image, you can understand how it's acting on there. Okay. The next slide we are discussing here, atropine. Atropine is the first antimuscarinic agent. Okay, the actions of atropine. These slides are very, very important. Each and every point, whatever I highlighted here, please note in your notebook also. Okay, the atropine actions. The first one in the eye, what's doing on there? We know we are discussing here the antagonist. That means opposite of the parasympathetic. This is parasympatholytic. That means it's producing the sympathetic action. So what is the sympathetic actions? We know mydriasis is happening there. That means dilation of pupil. So atropine blocks muscarinic activity. And cyclopegia, cyclopegia is a condition inability to focus for near vision. That is the cyclopegia. So what are the actions in eye is mainly the atropine is used for the mydriasis and cyclopegia. So it's contraindicated with angle closure glaucoma. So we know in the it will increase the condition. So it will stimulate the condition. So it's contraindicated with angle closure glaucoma. It's not used for that purpose. Okay, please remind it. Very important point also. The next one is what's happening in the gastrointestinal tract. Atropine as the is a active isomer of the L-hyoscyamine, can be as an antispasmodic. So atropine is a antispasmodic. So what they are doing, it decrease the GI tract activity and decrease the contraction. So these are the main actions, same as like sympathetic. That means parasympatholytic actions. Okay. And the third point is atropine and scopolamine. These are the most potent antispasmodic drugs used in our society. For this one, the atropine and scopolamine is the most potent antispasmodic drugs. Very important point. We can expect questions based on this highlighted points. Okay. And the next point is atropine will not reduce the HCl production, hydrochloric acid production. So it's not used for peptic ulcer. So it's not reduced the HCl production. So that's why it's not used in the peptic ulcer also. Which drug is used for the peptic ulcer also? We are discussing here pyrancepine. Pyrancepine antimuscarinic agents. It decreases the gastric acid secretion. So it can use for the peptic ulcer, gastric ulcer, and duodenal ulcer. So these are very important. Please thorough with this one. Okay. And the next one we are discussing here, the atropine, how it's acting on the cardiovascular. That means how it's affecting on the heart. It's a divergent effect is showing on there. In the low dose, the atropine is showing decreased heart rate. Decreased heart rate means it's showing the bradycardia. So same as like agonist action. In the lower dose, it's showing a agonist action, but in the higher dose, what's happening on that? It increases the heart rate. Heart rate means tachycardia, that by blocking the M2 receptors. Okay, these are the main actions happening in the cardiovascular. Okay, please note down this one also, very important. And the next one is what's happening for the secretions. Secretions means inhibition of secretion is doing the atropine. Okay. That means this is sympathetic action, same as parasympatholytic, that means parasympatholytic action. So opposite of the agonist. So that's why the atropine is cholinergic antagonist. So it's inhibition of the secretion. It blocks the muscarinic receptors in the salivary glands, lacrimal glands and sweat glands. That means it decreases the secretion of this one. Okay, and inhibition of secretions by sweat glands can cause elevated body temperature, which can be dangerous in children and elderly. We know the secretions are inhibited. The blocking the secretions means it can cause the elevation of the body temperature. It's very dangerous condition. Okay, hypothermia, these things are happening. So these are the main important points happening in the actions happening in the secretions for the atropine. Okay, and the next one we are discussing here, adverse effect for atropine. Mainly, what are the adverse effect? Blurred vision, dry mouth, sandy eyes, mydriasis, tachycardia, urinary retention, constipation. Okay, and CNS effects also I mentioned here, restlessness, confusion, hallucination, delirium. Okay, just for understand these things only. Okay, the next point we are discussing here, uses, very important. We know atropine can use in the ophthalmic. So it's used in adults and children to dilate the pupil before an eye exam or surgery. In any eye exam or surgery cases, we want to dilate the pupil, we can use the atropine because the action is mydriasis. So that's why it's using for the ophthalmic case. Okay, and the next use is antispasmodic. We know it relaxes the GI tract, so that's why it's used as antispasmodic. And the cardiovascular means it can used to treat the bradycardia. Okay, that means in the bradycardia condition we can use this one. In the high dose, the atropine can increase the heart rate, so that's why it's used for this one. Okay, in the anti-secretory, to block the secretions in the upper and lower respiratory tracts prior to surgery. If in any surgery case we want to block the secretions of the respiratory tract, we can use the atropine as an anti-secretory. Okay, then the next important point is antidote for cholinergic agonist. We know the physostigmine. That time we already studied this one. Parenteral atropine is used for the physostigmine overdose. So it's used as antidote for physostigmine. So one of the important point. Okay, and the next point is it's also used for the treatment of organophosphate poisoning. That means malathion, parathion, that one. Insecticides and nerve gases poisoning also, this atropine can use it. And overdose of anticholine esterases, we already mentioned the physostigmine it's used. And also some type of mushroom poisoning also the atropine can use. These are the main uses of atropine. Very, very important. Please thorough with this one. Okay, and the next one is scopolamine. Scopolamine is to prevent the motion sickness. One of the important use for the scopolamine. We know we are using this one in our pharmacy daily basis also. So we know this one. Prevent for the motion sickness. Drug of choice for motion sickness is the scopolamine, and it's also used for the post-operative nausea, vomiting. Okay, and then the ipratropium and tiotropium. These are, we know normally it's using for the inhalation. Ipratropium normally the daily dose is QID. QID means 4 times daily. It's used as a bronchodilator, and so it's used for the treatment bronchospasm associated with chronic obstructive pulmonary disease. In this case, we can use the ipratropium for bronchodilation. Okay, that means acute management of bronchospasm in asthma. So that purpose, that treatment, we can use this one. Okay, and this one, the next one is tiotropium. Tiotropium also the same as like ipratropium, inhalation, but the daily dose is OD only. That means once a day only. So it's also producing the bronchodilation action. So that's why it's used in the treatment of bronchospasm associated with chronic obstructive pulmonary disease. Okay, these are the main uses of this one. In the next slide, we are discussing the next drug, tropicamide and cyclopentolate. The agents used used as ophthalmic solutions for mydriasis and cyclopedia. This one also we already mentioned, because the main actions of cholinergic antagonist is mydriasis in eye. So these can use for this purpose. Okay. The next one is benztropine and trihexyphenidyl. These are the drugs used to treat the Parkinson's disease. Don't confuse with that one. By mistake I mentioned on there. In the cholinergic agonist, that is mainly used for Alzheimer's disease. Okay, sorry for that. So benztropine and trihexyphenidyl to treat the Parkinson's disease. Okay. And dariphenazine, fesoterodine, oxybutynin, solifenazine, tolterodine, trospium chloride. These are mainly used in the treatment of overactive bladder. If any drug from this one in the option, you can choose it for the treatment of overactive bladder. Okay, in the option thoroughly check it and choose it. Don't confuse with the options. Please apply your basics theory in the correct way. Okay, these are the main drugs. The next one I mentioned here for the the next I mentioned here the summary of drug and therapeutic uses. What we already discussed, the same one. I just make a copy from the Lippincott. Just check it. If it's not clear this picture, you can check in the page number 69 in the 6th edition. I have that one only, so that's why I mentioned here like that. If you have the updated version, you can check it on there. Okay. And the next slide, I mentioned the next classification, ganglionic blockers. Ganglionic blockers, we know it's mainly nicotine. So the nicotine at low concentration, it stimulates the receptors, and nicotine at high concentration it blocks the receptors. So depending on the dose, nicotine depolarizes the autonomic ganglia. So it's resulting first in stimulation and then paralysis of all ganglia. That's happening on there depending on the dose. Okay. The stimulatory effects are complex and result from increased release of neurotransmitters due to effects on both sympathetic and parasympathetic ganglia. Just for the introduction, if you want, you can check in the image in the neurotransmitters action. It's not that much important. For the introduction purpose, I just mentioned, just read it and check it. Okay. And the next section I mentioned here, we already mentioned, depending on the dose, it's blocking, sometimes it's stimulating. That means enhancing the action. Whatever the nicotine normally happening, that's I mentioned here. This is same as like Lippincott. The picture is not clear, you can check in the page number also. Just go through this one. Not that much important, but just check it. In the coming chapters it will very helpful. Okay. And the third one is neuromuscular blocking agents. These agents block cholinergic transmission between motor nerve endings and nicotinic receptors on the skeletal muscles. We know this one. In the image also we mentioned what's happening on there in the nicotinic receptors on the neuromuscular junction. Okay. So it's the important one is the neuromuscular blocking agents, mainly it's given intravenously or intramuscularly, not given orally. So the route of administration is intravenously or intramuscularly. Okay, important point. We can expect questions based on this one. And mainly two types are coming: non-depolarizing and depolarizing agents. Non-depolarizing is the competitive blockers. Okay. Competitive blockers also known as. So the next section I mentioned what is the normal mechanism of action happening for that one. That's I mentioned here for the competitive. You can just check it. You can understand how it's acting in the receptor. Okay. The next slide I mentioned both non-depolarizing and depolarizing, the comparison and the differences. Okay. So that is very easy to understand. So that's why I mentioned, or otherwise it becomes too much slides. So that's why I mentioned like this. Okay. So the non-depolarizing blockers, first the drug to block the skeletal muscle neuromuscular junction the first drug is curare, then it's changed to tubocurarine. So the curare is the first form, then it's developed to drug form to the tubocurarine, then it's replaced by the fewer ADR agents, the adverse effect less agents like rocuronium, cisatracurium, pancuronium, vincuronium. Okay, these are the main drugs used nowadays. Okay, these are very fewer ADR adverse effects agents, so that's why it's using, and it increase the safety of anesthesia patients to recover quickly and completely after surgery. That means less side effect, less adverse effect only for this one, so that's why it's increase the safety of anesthesia. Okay, so the depolarizing agents, what's happening on there, the depolarizing agents, the plasma membrane of muscle fibers similar to the action of acetylcholine. Okay, the first, what they are doing, the agents are more resistant to degradation of acetylcholine esterase and depolarize the muscle fibers. That is the main actions happening on there. The main drug is used for the this one, succinylcholine. Succinylcholine is the only depolarizing muscle relaxant in use today in surgeries. Okay, so one of the important point, the main depolarizing muscle relaxant is succinylcholine. Okay, in the next slide, I mentioned how the succinylcholine act in the receptor. Okay, phase 1, phase 2, how it's acted. You can just check the picture, you can understand it. Okay, very simple, not that much important. We want to understand it, so that's why I mentioned. Okay, the next slide we are discussing here, in the lower dose, how the non-depolarizing blockers happening on there, how it's acting, and how the high dose, in the high dose, how it's acting the non-depolarizing blockers. Okay, in the lower dose, it compete with acetylcholine for binding for nicotinic receptors, partial blocking only, mild relaxation is happening on there, but in the higher dose, complete blocking is happening. In the both section, in the both cases, we can reverse this one with by a choline esterase inhibitors, because the and blocking action we can reverse it with a cholinergic agonist like neostigmine and edrophonium is the example of this one. We can reverse it this one. Okay, in the depolarizing agents, we already mentioned depolarization is happen in the high dose, lower dose, the same thing is happen, then it mimic the acetylcholine binding to its receptors. That is happening on the depolarizing agents. Okay, just for understand, I mentioned only, just check it. Okay, important point is succinylcholine. Okay, from this section, important point is succinylcholine, and in non-depolarizing blockers, important point, it can be reversed it with a cholinergic agonist. That means choline esterase. With a choline esterase, we can reverse it this one. Okay, and then I mentioned here ADR of non-depolarizing and depolarizing. From this section, ADR of depolarizing is more important. Hyperthermia, apnea and hyperkalemia, very important. We want to thorough it. Maybe we can expect questions based on that. Okay, and in the non-depolarizing blockers, I mentioned the drug interactions. Not only this much, halogenated hydroanesthetics, aminoglycoside, antibiotic, calcium channel blockers only I mentioned here. Some of I think 2-3 more on there in the textbook. If you want, you can check it. Just for understand, I mentioned this one. The halogenated hydroanesthetics and aminoglycoside, antibiotic, calcium channel blockers, these are increasing the neuromuscular blockade and increase the skeletal muscle relaxant activity. These are the main drug interactions with this one, non-depolarizing blockers. Okay, so these are the main points only this one. So at the last, the end of the slide, I mentioned some important notes. The tropicamide mainly it's in the eye drop form, so it dilate the pupil. That means it producing the mydriasis action, so it's helpful for the eye examinations. Okay, so it's mainly available in the eye drop form, so it's not available in the parenteral form. That means it's not available in the injectable form. The next point I mentioned here, non-depolarizing blockers such as cisatracurium and vincuronium, these are parenteral. We already mentioned the neuromuscular blocking drugs are mainly available in the intravenous or intramuscular form, so it's not available in the oral form. So that's why again I just mentioned, maybe based on the recalls I mentioned these points. Okay, And the first contracting muscles means the in the contracting section, first the face muscles contracting, then eyes, then diaphragm. These are the order of the contraction of muscles. In between eyes and diaphragm some more is there, but these are the main order of this one. We want to understand it. So today I'm just wind up this much only. We want to know about it, cholinergic agonist and cholinergic antagonist. So today I'm just wind up. Thank you for your support, and just again I remind it, please subscribe, share and like my videos. Also you can mention your valuable comments in the comment box. Okay, thank you.